they can cause lactobacillemia, which may be worse than what. If you can, what the Finnish people are doing is they were giving it before the surgery, but even then the patients were kind of sick. So
You have to be careful.
Just to clarify,
please. In favor of using it, yeah. There was one comment by go ahead.
no, I was just going to say the pancreatitis, the problem with that study wasn't, my understanding anyway, wasn't that lactobacillus bacteremia occurred. What happened is the patients had ischemic bowel, and they actually, and it led to increased mortality in the probiotic group. But it wasn't linked, as far as I know, to the live microbe. What it was linked to was they were doing nasal jejunal administration of a dairy-based probiotic prep, and that coagulated and actually blocked the bowel, and it ended up being a dangerous intervention. So I don't think they increased levels of sepsis in that study, but they did increase mortality, and it was due to the ischemic bowel.
Great.
Just to add a point on that, there was a study done in Stanley Medical College by Dr. Madan and team for colonic resection, and especially I think it is partial colectomy or so, and probiotic shown to reduce the incidence of sepsis and other, they gave a protocol of giving probiotic for 1 week prior to the surgery, and then they followed up, especially when it involves the resection of the lumen. Probiotic goes a long way in reducing the incidence of sepsis and post-surgical sepsis and other complications, especially anastomotic leak, etc.
So that really comes.
This study was done in Stanley Medical College, Chennai.
Okay.
So that's nice to know. In fact, that kind of completes the circle, because if we think about preventative versus therapeutic, that difference is very clearly shown in that study. And we have seen in our own hands, and there are multiple papers, that several of these probiotics, they induce tight junction proteins. They will express zonulin, claudin, and you can see it black and white that they really do it. So if you have really brought the the subject to an improved state of health, yes, it will be helpful. But if they're already sick and you are giving it, then we have to think of
It becomes an issue when the million-dollar question is how this probiotic works if the patient's immunity is compromised or the circulation is compromised. What happens in hemodynamically unstable patient? These things are yet to be studied.
Yeah, next question.
Good morning to all.
Please introduce yourself.
Yeah. Good morning to all. This is Dr. Bharat Bhushan, PhD pass out from NDRI Karnal and presently working as a research scholar in NIFTEM. Dr. Sanders, I am happy to be present in such a nice presentation. My first question, I got your point that live microorganisms with some functionality or some probiotic organisms, using them in functional food or fermented food form, and we get health benefits. I just wanted to ask one question, that what could be the better option, whether use those functional or probiotic strains in concentrated form like in capsules or other forms, or in the form of fermented food or functional food products?
Well, in my opinion, if we're talking about dietary recommendations, I think that it's probably more appropriate to try to focus on foods that can deliver those microorganisms, because we're talking about people constructing a healthy diet. Having said that, if the body of research includes evidence from both food supplements as well as foods, then I think we have to be true to the data and say that either of those sources are appropriate, and then it's up to the individual to determine how they want it, what products they want to include.
Thank you.
Can I add?
My second question, please.
Just a minute. I think, as you said, in fermented foods, it will be easier because the regulations are still relaxed as far as the food is concerned. To label any probiotic as a capsule or as a therapy will require a lot of, permissions and all that. So from that angle also, if you are using any particular probiotic as a food supplement, it will be easier to use that. As far as, at least in
Right.
India, it is becoming much easier to have anything in food as a food rather than taking it as a drug or capsule.
But a capsule may be better defined, and so you
Yeah.
may understand the levels that are being delivered, and I mean, if they're if they're properly manufactured, that the amounts as well as the identity of the particular
Yes,
strains,
that
and that's
we,
one advantage over a supplement, assuming it's properly done.
Yes.
Thanks, ma'am.
Yeah.
Just a minute.
My second question is, yesterday also we were talking about the transient colonization of probiotics. If we are isolating strains from unexplored regions where people were not taking any probiotic supplement, so we are isolating those strains from stool samples. So there are more chances that, and we are not making them probiotics. We are studying whether they were already having that genetic repertoire of being probiotic. So we are not making them probiotic. They were already probiotic, residing in the gut of unexplored niches, I don't think that it is certain that they will colonize only transiently.
Okay, so there's a couple of things that cross my mind that I have to respond to. First of all, it's very common to hear people say that we have our own beneficial probiotics in our body. So we're colonized with probiotics always. And I would dispute that. I would say you don't know any given microbe that is in your body as a probiotic until you isolate it and test it and show that it has a health benefit. Because there can be benign microbes associated with your body, there can be potential opportunistic pathogens associated with your body. So to me, I would not use the term probiotic to apply to our normal colonizing microbes. So I disagree with your usage in that regard. Secondly, it's completely possible that at any given time we have lactobacilli or bifidobacteria or other potentially beneficial microbes that are transiting our body. So just because you isolate it out of stool does not mean it's a permanent colonizer. And thirdly, an organism that might be a permanent colonizer for you is very likely to be a transient colonizer to me, because we have such individual microbiota components. And so even if you did have evidence that a particular strain was a permanent colonizer for you, there's no guarantee that once that organism is removed, grown up, and reintroduced to any number of people, that it will be permanent colonizer. And if I were a betting person, I would say it probably would not be a permanent colonizer. So I think that this issue about temporary colonization, it seems to resonate with people here, but I don't think it's a negative. I think the fact that these organisms can be introduced and they can grow for a period of time but eventually are lost does not detract from their functionality.
Thank you.
So, this last question, yes.
Hi, I'm Dr. Disha Ahuja. I'm shifting gears a little bit. I'm more interested in the process of manufacturing these prebiotics and probiotics. And my question is to do with the prebiotics. Should they always be added to the probiotics regardless of strains? Or should we even be manufacturing these prebiotics separately and recommending those as a health supplement?
There's many, and in fact, most of the studies that have been conducted showing physiological benefits or health benefits of probiotics have been conducted with a probiotic that is administered with no additional prebiotic included. So there's no requirement for a prebiotic to accompany a probiotic. Now, what you decide to do is going to be very much dependent on what evidence do you have to show that a given prebiotic can support an improved health benefit over the probiotic alone. And to the extent you can document that, then I think it's great to combine those. But if it's combined in 2 separate pills or in one product, has everything to do with more technological questions, I think, than evidence.
So just one more clarification. What about standalone prebiotics to help the natural microbiota?
Right, and I did have a very brief slide on that, just there's accumulating evidence on fructooligosaccharides, galactooligosaccharides, inulin, and a bunch of others that are emerging that show that prebiotics on their own can have a positive impact on the microbiota and a health benefit in a variety of different endpoints, immune and glucose tolerance and functional bowel and things like that. So they can be viewed as independent, and they certainly can be viewed to function together. But you have to, the